This final story today is particularly troubling. So what if I told you that a government agency that was literally invented to protect employees' health and safety was altering its policies so that employee health and safety protections would be reduced? Because that's exactly what Osha just did. So Osha has changed its guidance on adverse reactions to mandated coronavirus vaccines, guidance that was in place until just last May. So a little background on Osha. Obviously, that's the U.S. Occupational Safety and Health Administration. Osha was created to assure safe and healthy working conditions for men and women. And OSHA gives guidance to private sector employees regarding safety conditions. And this guidance affects I think over like 100 million private sector workers. Now, again, OSHA was created to reduce injuries and illnesses and fatalities in the workplace. It's literally their job. It's what they do. So it makes sense that OSHA would want employees who suffer any kind of adverse reaction to an injection mandated by the federal government through the employer to report it. After all, if a company is going to require its employees get vaccinated, then of course employers ought to report if their employee had an adverse reaction. I mean, many employees are only taking the vaccine and getting the injection because they've been forced to by their employer. So here was OSHA's guidance on recording adverse reactions as of May. They said, quote, if you require your employees to be vaccinated as a condition of employment, then any adverse reaction to the COVID vaccine is work-related. The adverse reaction is recordable if it is a new case and meets one or more of the general recording criteria, end quote. See, those are the words you would expect from an agency that exists to protect workers, you know, the thing that OSHA was created to do. But here's OSHA's new guidance on recording adverse reactions to the vaccinations. They write, quote, OSHA will not enforce 29 CFR 1904's recording requirements to require any employers to record worker side effects from COVID-19 vaccination at least through May 2022, end quote. Those are like it's up on their website. Those are the words of a corrupted agency that abandoned its mission of protecting workers. OSHA wants to know if someone slips on a banana peel in the break room, but they don't want employers to record and report adverse reactions to the COVID injection that is mandated by the federal government through employers. Why? Well, they say that they don't want to disincentivize the employer's vaccination efforts. And if adverse reactions to the jab are exceedingly rare, as we're told, then why would reporting rare adverse reactions by private employers be discouraged? I mean, adverse reactions aren't even a thing, according to the CDC and Dr. Fauci. We're constantly told that we need to not worry about them. So why is OSHA changing its guidance on COVID vaccinations, telling employers that they don't have to report adverse health outcomes when they're supposedly so exceedingly rare? Maybe it's because adverse reactions are happening and maybe they're not as rare as people would like for us to believe, and they don't want anyone to know because the administration is hell-bent on its injection or bust policy. Who knows? No one's going to give you answers, so I guess we're free to speculate. One thing is absolutely certain: OSHA is not interested in protecting employees' health and safety as much as its intent on advancing the administration's mandated vaccine policy. And it also proves that all government agencies, even ones invented to protect workers, can easily become tools of the state that simply exist to implement the state's objectives. All this does, by the way, is make every thinking human being wonder what's really going on. This destroys institutional trust rather than increases it. And the move from OSHA will fuel every conspiracy theory imaginable, because it's more proof that public health is not what our government's pandemic response is ultimately about. Increasingly, it seems to be about a whole lot more than that.